Hey there. When you hear the words rheumatic disease, what's the first thing that pops into your head? For most of us, it's probably achy, painful joints. But what if I told you that was just the tip of the iceberg? Today, we're going to dive deep and explore why these inflammatory diseases are about so much more than just joint pain. So let's just get right to it. Is a condition like rheumatoid arthritis, or RA, really just about having sore joints? The research shows that if you think of it that way, you're missing a much bigger and, frankly, a much more dangerous picture. The answer is a hard no, and the reasons why, well, they're pretty startling. Take a look at this number. 2 times. A study that ran for 14 years found the patients with rheumatoid arthritis have double the risk of dying from cancer compared to everybody else. That's right, double. That one statistic just completely shatters the myth that RA is only a joint problem. It's a systemic issue with some really life-threatening consequences. And that brings us to the key idea for today, comorbidities. It's a bit of a medical term, but all it means is having one or more other diseases happening at the same time as a primary one. See, inflammatory rheumatic diseases, or IRDs, affect your entire body. They don't just stay in one place. And that creates the perfect storm for other serious health problems to pop up right alongside them. And listen, these comorbidities aren't just minor annoyances. They have huge consequences. They can actually make the treatments for the rheumatic disease work less effectively, they can speed up disability, and, like we just saw, they seriously increase the risk of death. It becomes pretty clear that managing these other conditions is every bit as critical as managing the joint pain itself. So, what are these hidden dangers we're talking about? Well, the research points to 3 major categories of risk, a trio of threats that patients and their doctors really need to be on the lookout for. Let's break them down, one by one. Okay, first up, your heart. The constant body-wide inflammation from these diseases can really do a number on the lining of your blood vessels. It leads to something called atherosclerosis, which is just the hardening and narrowing of your arteries. That, in turn, kicks off a higher risk for things like metabolic syndrome and even diabetes. It's like a whole cascade of cardiovascular problems that can be silent, but deadly. The second major threat is cancer. For someone with RA, the risk of lymphoma is 2.5 times higher. But get this, for patients with Sjogren's syndrome, the risk of non-Hodgkin's lymphoma just skyrockets. We're talking 13 to 18 times higher than the general population. That shows you the link between these autoimmune diseases and cancer isn't just a small correlation, it's a massive clinical concern. And the third threat is kind of a paradox. The very medicines that are used to control the disease, these powerful immunosuppressive drugs, can also lower your body's defenses against infections. This leaves patients vulnerable to all sorts of things, from serious lung and skin infections to waking up dormant viruses like hepatitis or herpes zoster, the virus that causes shingles. Some drugs can increase that shingles risk by 4 to 7 times. So you're faced with this trio of threats. What's the solution? Well, all the evidence points to one thing, a comprehensive, team-based approach. This isn't about fighting one battle at a time. It's about building a powerful, coordinated defense. We're talking about a multidisciplinary team. The best way to think about it is like a holistic health pit crew for the patient. It's not just one doctor looking at one symptom. It's a coordinated group of specialists, nurses, therapists, doctors, all working together from the same game plan to treat the whole person, not just one part of their disease. And in that pit crew, the nurse has an absolutely essential role. They are right there on the front lines. They're the ones leading lifestyle changes, educating patients about all these risks we've been talking about, and doing the crucial screenings that can catch these other conditions early. They really empower patients by helping them understand what's actually happening in their own bodies. Now, the physiatrist, you can think of them as the team's quarterback. This is a doctor who specializes in physical medicine and rehabilitation. They're the ones designing the whole rehab strategy, keeping a close eye on how the patient is doing, and calling audibles, adjusting the plan along the way to make sure it's working. Then you've got the occupational therapist. They are all about the practical, hands-on stuff for daily life. They teach patients how to protect their joints, how to change the way they do certain activities to reduce pain and stiffness, and they bring in physical tools like special exercises or splinting. Their whole job is to help patients manage their own condition and function better in the real world. Okay, so we know who's on the team. Now let's look at their playbook. What are the actual interventions they're using? And these aren't just good ideas, they're evidence-based strategies that are proven to make a real difference. One of the most powerful plays in the book is personalized exercise. I mean, look at this chart. It shows what happened after just 6 months of a high-intensity program for RA patients. You can see a huge, measurable jump in their cardiorespiratory fitness, and that's a key marker of your overall health. And getting more fit isn't just about feeling better. It literally translates into saving lives. The research is crystal clear. This kind of rehab significantly reduces the risk of dying from heart-related issues, it cuts down on hospital stays, and it lowers the chances of having a heart attack. The impact is just massive. But all that physical work is really only half the battle. The other half is knowledge. It's wild, but studies have shown that many people with RA just have no idea about their increased heart risk. So a huge part of the playbook has to be education, closing that information gap so patients can become active partners in their own healthcare. So what happens when you bring all of this together? When you have that expert team running plays from an evidence-based playbook, the result is a really profound improvement in a patient's entire quality of life. And the range of benefits is just incredible. We're talking about better physical function, of course, but also way less pain and fatigue, better mental and psychological well-being, fewer trips to the hospital, and even a lower risk of developing dementia down the line. It's a truly holistic outcome that goes so far beyond just the joints. So if there's one single thing you take away from all this, let it be this. Inflammatory rheumatic diseases are whole body problems, and they demand a whole person solution. If you only focus on the joints, you're missing the cardiovascular, the cancer, and the infectious disease risks that are actually the biggest threats to a person's life and well-being. Which really just leaves us with one final question for you to think about, whether it's for yourself or for someone you care about. Is the treatment plan you know of truly looking at the whole picture? Thanks for joining me for this explainer.